Alright, so I left off talking about our development of our cardiovascular system in a early embryo. So we start out with that tube heart, and about week 4 it's going to be pumping, and then by week 7 we're going to get our 4-chambered heart that we know and love today with the atrium and the ventricles. So after week 7 you're not really going to have many changes in the heart. It's going to be structured how we use it and how it looks today. So a lot of congenital heart defects, that makes about half of those infant deaths for newborns and from these congenital problems. And a big factor that contributes to these congenital heart defects include maternal infections. So if mom gets some sort of pathogen in her during that first trimester, the baby could either not come to term, or if it's born, it could have some serious issues, if not die from them, as well as just drugs and alcohol within that those first 3 months can really play a significant role in how that infant is going to thrive. Also, some congenital heart defects include the ductus arteriosus, may not even close up for some infants, and they'll go in and do like a surgical correction that seems to be that's pretty successful. Also, after that 7th week, you're going to have very few changes after birth, or very few changes are going to occur, and then after birth, the umbilical cord and those vessels, they're going to start blocking up and stop functioning, so that baby is going to have to have his heart work on their own. Okay, so there goes the babies. Alright, so as we age, we're going to have some problems, or potential problems, with our cardiovascular system, and this includes just our venous valves starting to weaken, so it's going to be a little harder to get blood back to the heart. We could also have some development of varicose veins, which I have a picture right here. There's those kind of, varicose veins, and they're hard to avoid. Not everyone may get them, but you have a very good chance if you're on your feet all day, or even like other contributing factors like overweight, less exercise, can lead to those varicose veins. You could also get progressive arteriosclerosis. So remember, that's our hardening of our arteries. So I tried to put a picture in here to show a normal artery on the left, middle arteriosclerosis, so we're starting to get a little bit of a buildup going on in the arteries, and then finally here is severe arteriosclerosis. So you can see how that's going to increase our blood pressure there, because there's hardly any room for blood to pass through, which is very, very bad. And we can also, they say that ever since we're born, we all are going to have those arteries hardening from the day we're born. So having a good diet and exercise is going to keep those plaques and that buildup from occurring. Hypertension is also going to occur from our elasticity in those vessel walls just kind of wearing out, so that can lead to some high blood pressure. And the coronary artery disease, if you have fat, calcium deposits in your vessels around your heart, this can lead to a thrombus, so that clot. So you are as old as your arteries. That's kind of an old wives are saying. So take care of yourself so they are not going to harden up. 30% of the United States has hypertension, so that's a problem that we can definitely work on. And I'm pretty sure that heart disease is the #1 killer of women. Now, I'm not sure if that's in the U.S. or the world. I'll have to look that up later, or maybe you can look that up in a little bit, check me on it, but I'm pretty sure it's like #1. And the coronary artery disease, that results in about half of American deaths that have to do with heart disease happen with coronary artery disease. Okay, so what can we do to help help our hearts, well, we can watch our diet. So make sure you're not eating so many fatty foods, lay off the McDonald's. Check your cholesterol. So usually like Cheerios, there's always talking about helping lower cholesterol, so that can help. And just watching your salt intake, because we know if we take in a lot of salt, our kidneys are going to usually retain it, and that means they're going to retain water, and that means they're going to hang on, we're going to have higher blood pressure and blood volume because of all this water and salt being retained. You also need to stop smoking, or just never start, folks. It's a nasty habit. Don't do it. So that's going to also cause plaques to build up, and it's going to be difficult to breathe and exchange oxygen, and just don't do it. It's nasty. People don't like it. All right. And just do some regular aerobic exercise. So get your heart pumping. So this can help just, going out for a walk, or maybe you start jogging or biking. That can all help reduce and reverse those risks of atherosclerotic process, those hardening and plaque buildup in your arteries. And you could live longer. But make sure, you're not just a once a month or, or the weekend athlete. A lot of people as they age, especially if they're kind of a weekend athlete, like just going out once a week, their heart hasn't really been provided the benefits of those aerobic exercises, and you're actually putting a lot of strain on your heart. So that's why you hear in the wintertime people that go out and they shovel their snow, and they have a very heightened risk of a myocardial infarction, which we'll do this Dora the Explorer style. So if you remember what myocardial infarctions are. Good, yes, it's a heart attack. So yeah, so you should work out and don't just go shovel snow and do lots of work when your heart isn't ready to take it, because you could die. So watch that. And I think that's our last, that's our last slide, folks. So some good things that you can do. See, I'm studying at my on my desk right now. I got my book open, checking the clock. Need to go softball here. But if you look in your book, let's see, we're going to skip chapter 12, so don't get too crazy about starting chapter 12 workbook pages, or you could be doing things for, not for nothing, but not for anything, but I'm not going to be doing that chapter next. So if you look at your objectives, so see these objectives here, I also should have them listed in the bundle on my big campus, and if I don't, I will try to fix that this weekend. But you definitely want to make sure you can do all of these objectives. And here's some great summaries to kind of work through. So here's some more summaries. Yay, summaries are always good. Oh, here's some review questions, and a lot of these will look very similar to what you have in your workbook. If not, some of them are exactly the same. And I know a lot of us struggle with those short answers, so here are some short answer essays. I bet you're going to be seeing some of these on your exam. And wow, here's some more. So if I were you, I'd go through these and make sure you can answer them all. And if you can't, you're not sure, we can always talk about it. And there's some at the clinic questions, which, hey, you may actually have some of those answers in the back of the book as well, because, oops, there should be some. Oh, baby. There's also some great questions, like the Q&As here. So there's the Q. Answer is upside down. I usually ask a lot of those during class. We also have, did you get it? And the answers are in the appendix. So usually these are very important too. Some of the different arteries, veins, pictures you should know. You should be able to label a heart and a lungs. Here's your anterior view of your heart. You should be able to label it. You should be able to label the ventricles, the arteries, trunks. Okay, here's the inside. You should be able to know the valves. Okay, the nodes. You should be able to do your pathway of blood. Okay, we spent a lot of time trying to get that, so make sure you can do it. Knowing just how those valves work, when they're open, when they're closed, because that also deals with pathway of blood flow. Here is the intrinsic conduction system. Hey, you may have to label that. I know you did have some on your quiz the one time, which I will get those unlocked here. If they're not unlocked, please send me an email and let me know, and I'll unlock them. Here's just summary of events during diastole and systole, so you should be able and very familiar with these events. So there's another Q&A. You know, it's always good to look at these pictures. They kind of summarize a lot of text, so they're very handy if you can look through pictures and get them, as well as our tunics. Being able to label these. Here's showing how those valves work in your veins, getting blood back to your heart. And then our capillary beds with the sphincters, fun to look at. And then here we have some of those major arteries. Now I know your workbook page didn't make you do all of these, but make sure you can. I could ask you what some of these are. So make sure you can do it. Oh, here's some more. So make sure you can label them. That workbook page I gave you, your test one may not look exactly like it. You also have some arteries within the brain. So make sure you can label those. Oh, and here's going to be yummy placenta. So with the baby, make sure you can label umbilical veins, arteries, kind of fun stuff. Here's some pressure points. And when I return, we'll work on taking our blood pressure. So we'll have some fun doing that. Oh, and here's our capillary transport mechanisms. So be familiar with those four. And how we have capillary movement. Alright, so that's in the text. I'll double check and make sure that we have everything up on my big campus. So you can always go to your bundles here. We are anatomy, resources. Oh, no, okay, so I guess I need to put it on there. Bad me. Alright, so I'll get that up there this weekend, and you guys can have some, I'll put all the objectives listed so they'll be handy for you. Alright, so I hope you have a fantastic Monday, and study up, and if you have any questions, you can always shoot me an email. Check your calendar. It's updated. Your test is probably going to be on that Thursday. Probably. I'll just type it in here. So plan on that. We're getting towards the end of May, so that means Anatomy in the News is going to be due, and I believe that's going to be your last one that we do. So make it a good one. Yep, that's going to be our last one, folks. And if you need a rubric, I can get you a rubric. I should have plenty for you. And we'll be working with our fetal pigs this week as well. So have a good one.